Hello and welcome to another blog post on activities for activity coordinators working in nursing homes and residential units, people working in day centres who have to provide activities, and for people working in sheltered housing units who have to provide activities. So what we're going to talk about is really a cornerstone of activity provision. On my last blog post I was speaking about something called batch care, and perhaps how sometimes we still provide activities, or the managers of some of the organisations we work with see activities as something that's provided to a group that is done to rather than done with your residents, your clients, the people you work with. So there's a couple of reasons why that's not good. Number one is just the morality of it, that people are all different and we need to treat them as individuals. Number two is that your chances of actually succeeding and getting the people to be actively involved is greatly reduced. I always use the analogy that I love exercise. Well, I love exercise when I'm finished. I don't love exercise when I start. So if I was to ask all you guys to join me on an exercise session and do push-ups, and we're going to do 500 push-ups, and that's the activity for today, how many of you guys would come in? How many of you guys would want to actually be involved? And the chances are, in the average care home, maybe one or two at the most. And then we wonder why we can't motivate people to be included. But if I was to find out what you wanted, and what you wanted to do, and what you were able to do, our chance of succeeding was higher. So that's really a summary of the last blog. Now we move on. So this brings us into the idea of assessment, person-centred assessment. One of the tools that I recommend out now is something called a functional independence measure. We explore how to use that on some of the courses we run. If you're interested in that, you can visit www.thctc.co.uk. You'd probably be looking at the Meaningful Activities course. That's the one that would open that out for you. What that does is it looks at the person in the round. It's an integral part of something called the Hop 6, which I'm not going to go too far into, but it's a movement and handling guide for care. And if your home uses that as part of a care plan, it allows you to build off and construct person-centred activities for the individual. The other reason why we do risk assessments and assess the individual for activity is because it's a legal requirement. And I've worked with day centres, residential homes, nursing homes, sheltered housing units, and I'd actually say 15-20 years ago when I first started doing all this, the split was probably 90% didn't want to do any sort of risk assessment. They didn't see the need for it, feel the urgency for it. I'd actually say now 90% realise the necessity of doing it. It's a legal requirement under the Management of Health and Safety at Work regulations, I do believe 98. Anything that you do in the workplace needs to be risk assessed, and activities, even in a residential unit, is an activity that you're providing in the workplace. So you need to actually assess that to make sure it's safe. When we speak about the FIM, the Functional Independence Measure, and it's sort of brother, the Functional FAM, Functional Ability Measure. So I had a brain moment there. It comes with age. What you've actually got are tools that will assess the individual for you. You still need to go out and have a look at assessing the environment you're going to deliver in. And that sounds like a lot of work, but it's not. Because if you work in a working environment, which we said is a care home or a nursing home or wherever you're at, there should be some sort of general risk assessments done on the areas within that environment, within the build. And also the final thing is that if you're providing activities, there's a risk assessment that would go with that for you as an activity coordinator provider for that particular job role. So some of the risks that you're probably going to face may be challenging behaviour, for example. So if that's a common feature of the work that you actually experience, then you probably would want some sort of challenging behaviour, responding to challenging behaviour, or as it's now called, responding to behaviours that challenge. Same thing, same course, but sort of training to equip you to deal with that. The other thing that is common with activity providers is moving and handling. So you're going to need some sort of training to equip you to move and handle safely. And when it comes down to the people that you work with, I always recommend that you are taught sit to stand and how to walk someone safely, how to push a wheelchair, how to help someone transfer. They're all the basic things. If you're not doing any hands-on care, there's not much need for you to have hoisting experience if the carers are there to hoist for you. So that gives you an overall picture of the type of assessment. There's another element that comes into the assessment of the individual, and when we're writing up notes we use something called a model of holistic well-being. That has 5 main elements that you need to think about: physical, mental, emotional, social, spiritual. And we're going to have a chat about those on the next blog post. So remember, visit www.thctc.co.uk as a gift for me. Just click on it, because it will bring me up the Google ratings and I'll be a happy man, even if you buy nothing. My gift to you is these posts as they stand. I hope you've enjoyed them and got something out of it. They do get more interesting. Sometimes the assessment stuff is stuff we need to cover, but it's a little bit dry. And I hope to speak to you again. Bye bye.